Thank you very kindly, Rob. And again, I'm honored, as have been all the participants, to be able to be part of this. It's a remarkable meeting. This is not going to be as exciting as the last talk you heard, and it's not going to match. Jamie Oliver goes to Rona at the beginning and does food services and home renovation. But if you're a bit of a policy wonk, this will be interesting to you. When we talk about what's new in pain in Canada in the last 5 or 6 years, one of the things that is definitely new is the amount of resource that's been devoted to research networks. And so you'll see here the experience with the Chronic Pain Network and with the brand new Veterans Center of Excellence. In terms of disclosures, what I have to disclose to you that given the amount of funding we've received from Canadian Institutes of Health Research and Veterans Affairs Canada, those are two groups that, in my opinion, can do absolutely no wrong. Apart from that, nobody's really competing very hard to buy my attention. So what I'd like to talk about, first of all, is the Chronic Pain Network. This has been in place for nearly 5 years now. It's funded under the Strategies for Patient-Oriented Research at the Canadian Institutes of Health Research. This is the group of principal applicants. You'll see that you will, if you're interested in pain research, care, education, that is a who's who of pain in Canada, and they're supported by almost 30 co-applicants on the grant. And we set it up with a pretty, I think, aggressive vision here. What we wanted to do is create a network that would enhance collaboration. We have 12 academic pain centers, more than 30 pain scientists. We created a structure which not only brings us together clinically and academically to develop research, but also allows us to parcel the information in such a way that it became accessible to policymakers, and that turned out to be very important. One of the goals is to enhance training of highly qualified professionals. Most of the focus is on researchers here, graduate students, but trying to continue to further develop our capacity to conduct high quality chronic pain research and also establish what's best practice care for chronic pain. And then finally, and in some ways most importantly, in this context of this Strategies for Patient-Oriented Research, is establishing partnerships with patients and with patient advocacy organizations. And that's really at the basis of this whole network. So again, in terms of what's new, this really is the first time that there has been a significant recognition at a policy and research funding level of pain as a priority. This is the first funded research network across the country dedicated to pain research. We were both slightly surprised and very pleased when the CIHR recognized chronic pain as a chronic disease, because that allowed us to enter into this competition supporting chronic disease research networks. And one of the things that's happened, and it really, that's a whole other talk, but it represents 10 or 15 years of very active advocacy on the part of patients, researchers, educators, and policymakers, is that the Canadian Pain Task Force, which you heard about yesterday, is now underway. And then from CIHR's standpoint, this is the first time they've invested a significant amount of money. It was $12.5 million over 5 years. And that's matched by funding from all of the partners, which was a total of $24 million. So the SPORE program, Strategies for Patient-Oriented Research program, requires matching funds. which means that we had to bring to the table a minimum of $12.5 million, not from federal sources. So it represents money that was going to be spent by research institutes across the country. That allowed us to enter into the competition. In fact, we were able to identify $24 million worth of funding directed towards pain research over 5 years, and that is what's been the underpinning of this research network. These are the partners. I'm not going to go through them all, but what you'll see is that it represents a truly national extent of people who are engaged in pain research and institutions who allocate money to pain research. Some of it is from philanthropic sources, some of it's from provincial sources. Some of it came out of individual departmental budgets to support various research projects or engagement in the clinical research network, a component of the chronic pain network. But really, it is a huge national collaboration. So what's in it? One of the key things, obviously, strategies for patient-oriented research are our patient partners. And you'll see their pictures across the country here, 19 patient perspective partners who've become a critical part of the organization. They don't only participate as collaborators in individual research projects, they also provide governance roles. Every one of our standing committees has a patient partner co-chair along with the investigator co-chair on the committee. And they have also independently put together what they call the Patient Advisory Group. That group was critical when Health Canada reached out to say, we realize we've missed the boat in our opioid response and we need to pay attention to the needs of pain patients. Where can we go? And this group was very quickly able to respond, and not only respond as their own group, Patient Advisory Group, but also connect Health Canada with their many other contacts throughout the country, which really had a big impact on how Health Canada has been approaching the opioid crisis. Another thing we created in this was what we call the Clinical Research Network. Canada is blessed with many academic institutions who operated busy clinical pain treatment locations, but for a variety of reasons, there have not been a lot of research infrastructure in those clinics. We were able to place a full-time research coordinator co-funded by both the clinic and the network into each of these sites, initially 10 sites, and then we've recently added 3 more sites in Quebec with the advocacy of the Quebec Pain Research Network to bring these 3 additional sites on. So, and that represents a substantial investment on an annual basis by both CIHR and the organizations putting up the matching funds. About a third of the budget goes to support specific research projects, most of which started out as single site, and some of them remain single site, and some of them have extended to do recruitment across the country and multiple other sites. So there are about 20 research projects. You'll see the money is certainly not equitably spread out across the country, but it represented the work that was being done on these projects at the time. And this is, we're now at the point, the 5-year mark of what was pitched as a 5-year network, and we're beginning to have all of these projects report in. Some of them have been completed and reported. Some of them are winding up the last of data collection, which of course was knocked off the rails by the COVID-19 crisis, but many of them are managing to proceed, and we're looking to start hearing reports, and we're really starting our 5th year knowledge translation push to get the information generated by the network out into the rest of the country. So looking forward, we are optimistically looking to plan for renewal and continuation of this network. It was established as a 5-year network. Planning for at CIHR and elsewhere has really slowed because of the need to respond to the COVID crisis. But we are working on our plans for what we think is important in the network and should be continuing. And the process and the organization of engaging patients in research, we think, is critical. And so we're looking to continue to expand that And we know that there's also been a growth at the provincial level of patient advocacy and patient engagement in research and policy making, clinical care, and education. And so we're looking to make links across the country as well as expand the number and the diversity of our patient engagement group. The clinical research network we see as having been a very valuable thing with these 10 and now 13 centers in play. We actually generated 100 individual site-based research projects, some of which have moved out to recruit at multiple sites. One of the major projects that we engaged in, led by Manon Chouanière at University of Montreal, is a pain patient registry. She had experience along with the Quebec Pain Research Network and some colleagues in Quebec establishing the Quebec Pain Registry, which then was halted for funding reasons, but she's had the opportunity to rethink how they approach that, to establish what we're calling a minimal data set that should be collected for patients, and we're starting to roll that out at each of the clinical research network sites. So she's done beta testing of the process at University of Montreal, the clinic at 𝐒𝐂𝐁𝐄, as well as the Alan Edwards Clinic at McGill University, and moving to the clinic at Queen's University now and starting to gradually spread across the country. One of the other things that we noticed, one of the first times we had our annual meeting, was that we had a number of individual projects, all of which were collecting biomarkers, all of which were collecting different biomarkers at different stages of follow-up. And so we convened a meeting about biomarker research in Canada. And one of the things that we're looking to do is, in conjunction with the Clinical Research Network rollout and the registry, is to really examine the way we collect biomarkers, how we collect them, which ones we collect, and how we store them and analyze them. So that looks like being a big deal for us in the future. So that's the plans for the future for this one. The other thing that's happened in the last little while is the recognition, and this is a brand new research network, and it's funded by Veterans Affairs Canada. And it is, however, seen as a resource for all Canadians, but it's responding to a specific problem that veterans face in Canada. So in Canada, there's about 700,000, 800,000 veterans in total across the country. About 100,000 of them have medical conditions attributable to service for which they receive support for care from Veterans Affairs Canada. Veterans Affairs Canada has had a research arm for a number of years, and they've established a study called the Life After Service Study, in which they survey veterans periodically with the assistance of Statistics Canada. And what they discovered was that veterans have worse health on average than the general Canadian population, and that nearly twice as many of them had chronic pain compared to the 20% number that we recognize in Canada at large. Also, 50% of female veterans have chronic pain, and then many of them, as you can see, almost 80% who have health conditions attributable to military service also have chronic pain. So pain was identified as a big deal for veterans. Veterans Affairs Canada was studying the business of how they could address that, and they've created 3 research institutes. The first one they created was CIMVR, the Canadian Institute for Military and Veterans Health Research. Several years ago, they set up one called the Center of Excellence for Mental Health and PTSD, based in Ottawa. And as you can see here, there's a big crossover between patients with chronic pain and patients with mental health. Substantial, if you think of Venn diagrams, you're looking at a very large overlap of these 2 conditions. And so about a year ago, in the spring budget, the Veterans Affairs Canada announced that they had allocated funding for a Center of Excellence for Chronic Pain. In July of last year, they announced that the center was going to be stood up, and they asked us at McMaster to to take over operation or create the center, and in large part because we already had the chronic pain network running, supported by CIHR. We had organizational experience, contacts, and systems in place, and we were able to actually turn the Center of Excellence on by April 3rd of this year. If you know anything about government work, that's actually pretty quick turnaround from funding in July through operation in April of the next year. It's set up, it's required by Veterans Affairs Canada to be set up as a not-for-profit entity. The key organizational stakeholders are McMaster University and Hamilton Health Sciences Corporation, which is one of the university-affiliated hospitals in Hamilton. And really, the vision is to improve the well-being of military veterans and their families suffering from chronic pain. And we are fostering a national network of interdisciplinary pain management centers. Our mission is actually to do research, but we realized that we had to link up with pain management centers who were providing interdisciplinary care and could do so for veterans. And so we've been reaching out and making those connections. And our goal is to both continue to do novel research as well as to engage in really active knowledge translation to ensure that military veterans and their families are receiving the best in evidence-based care. We've really adopted the procedures of patient-centered research here. We began by having several months of coast-to-coast travel where the CEO, Ramesh Zacharias, and one of our admin people literally traveled across the country meeting with veterans and meeting also the people who operate interdisciplinary pain clinics. Setting up the board of directors. 3 of the 7 members are veterans themselves, and we've created an advisory council which is comprised of 11 members, all of whom are veterans. And we're expected to do several things. We're expected to provide national leadership around chronic pain care for veterans. We are expecting to conduct our research according to priorities that are determined through veteran engagement, and that process is really drawn strongly on work done by Patricia Poulin, Jennifer Stinson, Katie Burney to develop both adult and pediatric priorities in pain, and we've used that to inform the veteran priority development process. This national collaboration of pain clinics, we expect to be delivering evidence-based interdisciplinary pain care. And to the extent that it's necessary, we're going to be conducting training and education of these interdisciplinary teams. We wanted to hit the ground running, and so we had several things that we were able to begin very quickly, mostly in the area of knowledge synthesis. Things like identifying the veterans' research priorities. The initial qualitative paper that describes these is currently in development and should be submitted for publication within the next 3 or 4 weeks. Rapid Recommendations is a service that was developed for the British Medical Journal to do with a very quick turnaround, approximately 3 months, provide knowledge syntheses that could support brief recommendations around certain key issues as they come up. One of those is cannabis. You heard from Hans Clark earlier the relative lack of science that exists about cannabis. That's a big deal for Veterans Affairs Canada. They're one of the few insurance providing organizations in the country who actually reimburse for cannabis for medical reasons, and it's a budget item of about $100 million a year for them. So less than what is spent on average in Canada per month, but it's a big budget item for Veterans Affairs Canada. The other interesting thing that came up was that Veterans Affairs and Canadian Forces Medical identified jaw pain as a big problem for them. And so those are the first 2 rapid recommendations that are going to come out. ICES, the Institute for Clinical Evaluative Studies in Ontario, is able to identify veterans. And so part of what we're going to be doing is looking at their data initially to find out what is the healthcare experience of veterans, because there's some really interesting issues around things like transitioning out of the active Canadian Forces medical care system into their veteran status when they receive care from the provincial healthcare systems. And so we'll be looking at the ICES data to get a better sense of that. Veterans Affairs Canada identified from a survey process with veterans that there are 7 key areas of well-being that are really worth measuring to track how well veterans are doing after their discharge from active service. And we're working to identify the best ways to measure those so that we can actually track veterans' well-being as they go through their post-service journey. 3 areas that we're starting to look into now is the transgenerational impact of chronic pain in veterans. And if you listen to Melanie Knowles' talk yesterday, pediatric pain, the impact of parents with pain or children with pain on the family, that interaction is really significant, and it's a priority that was identified by veterans when we spoke with them. They're concerned not only about their own well-being, but the fact that their well-being or lack thereof has a big impact on what their kids are able to accomplish and how their kids experience life. Issues of sex and gender differences, and you saw 50% of female veterans experience chronic pain. So we're going to be looking into that. We're starting to develop the protocols for that process. And then the benefits and or harms of cannabis use in veterans. Similar to the work that 𝐒𝐂𝐂𝐑𝐈𝐁𝐄 is doing, we're going to be rolling out a registry which was created by the Chronic Pain Network called DataCam, and modifying that now that we have a few years experience with it, trimming it down a little bit, making it a bit more accessible, and using it to examine the impact of cannabis use in veterans. So that's really a lot said. The network is funded with an initial statement in the budget that it will be funded for 5 years and then subsequently renewable, and the investment is between $4 and $5 million a year. So again, a significant investment by Veterans Affairs Canada in chronic pain research over the foreseeable future. So very exciting. Maybe not as exciting as some of the other things you've heard, but from a policy and an opportunity standpoint, both of these networks have really made some fascinating opportunities come to bear for pain researchers, pain clinicians, and patients across the country. So thanks very much, much appreciated, and I will look forward to the question session.